Okay, it looks like the numbers are starting to level out. So how is everybody out there doing? I'm hoping you're doing well and you're pros at Zoom now. I'll go over housekeeping just because that's what we do. But if you have questions, please put them in the chat box, and we'll get those for today's speaker. Or you can always, anytime, email us at info@columbiachamber.com. So again, thanks for joining us. I'm Rose Dangerfield, and I'm coming to you live from our new world headquarters on the corner of Lady and Sumter Street. So we are thrilled to be in our new space. We've been here, golly, almost a month now. So that's pretty exciting. But today, I'm particularly excited that we have Ashley Bodiford, who is with LRADAC, with us today to talk about mental health and how we're doing and how to remain resilient through all of this. Ashley is a regional capacity coach, and when I asked her what that meant, basically she provides training and technical assistance to staff in the areas of drug and alcohol misuse, tobacco, and other drug prevention. And her territory, keep me honest here, Ashley, it was pretty broad. It's mostly the Midlands, but I think it went all the way up to York County and over to Camden.
That's correct.
So that's a big area, and you all are doing some much needed work. Ashley has her Bachelor of Science degree in developmental psychology, a master's in public health, and a master's in human services. So we're bringing you a real pro and someone who has a passion for keeping us all safe and resilient and surviving in a healthy way during this time. So Ashley, I'm just going to turn it over to you. And again, I see we're already getting a few chats in. So please put your chats in there and take it away.
Well, thank you so much. Thanks, Rose, for having me. And thank you guys for being here this morning. I know it's different times these days, and I appreciate you guys getting on and letting me talk with you for just a little bit this morning about this topic. I know it's one that seems to always be at the back of everybody's mind and the bottom of our list about how we take care of ourselves, really just any time, not even amid a crisis like this, but in times like this, how present it becomes that we kind of need to check in and check on ourselves, just like we're checking on our families and our friends and our staff and our community. Sometimes we forget about ourselves. So I wanted to just talk a little bit with you this morning, nothing overwhelming, but just to kind of go over a couple of things that I know are really helpful during times like this. And also I hope that there'll be something that you can lean on, fingers crossed, when we return to some sense of normalcy, right? So I'm going to try to screen share, Rose, if that's okay. I kind of wanted to just show you all a couple of things. I think I can do it, but if I can't, it's not a big deal. We're all learning about technology these days too, right? So just give me one quick second to share that with you all. It looks like it's working. Awesome. So let me put it in a larger view so you all can see that. So what I kind of wanted to just run through was a couple quick things, like I said, about maintaining wellness, good mental health, kind of resiliency during these times. And because of that, we really have to go back and connect that we have to take a minute to kind of understand that we are in a major life change right now. So of course, focusing on COVID-19, we know that this pandemic has really probably brought significant changes to our lives. Uncertainty, our daily routines, some financial pressures, and then just that feeling of social isolation. We're going to talk a little bit about understanding social distancing versus social isolating, which often happens and has happened to several people that I'm connected with, because we have these uncertain feelings. We're worried about getting sick ourselves, our family members becoming ill, how long this is going to last, like how long are we going to be in this phase of not knowing kind of what's coming next. And that's hard, not knowing what the future may bring. It's hard for a lot of people. It's certainly hard for myself. Something also that really comes up is like the information overload too, that we have to be careful about. We're going to kind of talk a little bit about that, but making sure that we are holding true to reputable sources and not kind of getting lost in the misinformation and the unclarity of what to do next, but really kind of just connecting to what we know is true and resourceful and helpful. So it kind of lends itself well to just kind of talk about during this pandemic, we know that people are experiencing stress, we're experiencing fear, anxiety, sadness, loneliness. All of these feelings are normal, anticipated, and expected. So we're just going to kind of talk through a little bit about each of those, kind of taking care of ourselves in 3 different ways. So first, we're going to focus on an overall message of self-care. This is a word that gets thrown around a lot, but I don't know that everybody does it the best, myself included. We can say we're doing it, but sometimes we really do put ourselves last. So we're going to talk a little bit about understanding that self-care strategies are good for your overall mental health, but they're really overall good for your physical health too. So when both can kind of be balanced, we kind of have that center of peace, or that center of feeling balanced, or kind of a little bit more in control, a little more focused of what's happening. So it's really important that we're taking care of our body and our mind, but it's also really important that we are staying connected to benefit our mental health. I think that's been another struggle for many, is figuring out how you stay connected during a time when we have to distance. So you see here, I mentioned that connection doesn't only have to happen in person. So in-person connection has been limited. And of course, we know that because of the social distancing regulations, the travel restrictions, the closure of a significant piece of our state. However, we are still able to connect emotionally with people during this time. And that's something we want to make sure we're continuing to do. So just because we have to socially distance, doesn't mean we have to socially isolate ourselves from others. So we're going to talk a little bit first kind of about that physical health. I kind of mentioned we'll do it in 3 parts here. So when we talk about that, we really am focusing on taking care of our body. So some of these seem like regular, basic, like, oh yeah, no brainers, but sometimes we just don't do these things. So focusing here on making sure we're getting enough sleep. Again, this is something that I struggle with too, especially right now. I've been working remotely from home since mid-March. And I'm so thankful that I can work from home. I know many people don't have that opportunity. And I'm very thankful that for my agency, allowing that for us, especially because I have 2 small children as well. So we are in a totally new routine of being a homeschool. I don't even want to pretend to give myself credit to be a teacher because I am not, but trying to figure out how to get my 7-year-old the stuff she needs for her school each day, get my work done, entertain my 3-year-old, and just keep it balanced. So a lot of times I find myself in the evenings after everybody has settled that I want to check back in on work. Maybe I've missed something earlier in the day and I don't want to leave anything hanging. We can really get lost in that. It's okay to be responsive, but sometimes I'll look over and it's 11 o'clock and I'm like, oh no, what am I doing? I sat down at 9 o'clock to just kind of check in, and we get lost in it. So getting enough sleep and really trying to make sure you're on a schedule, even if you're at home. That's another thing I've had to even remind myself about. I am at home, but I do still have to maintain those boundaries, right? That work-life balance. So making a schedule, going to sleep, trying to go to sleep and get up at the same time, participating in that regular physical activity is also really helpful too. So just regular physical activity, exercise, just a walk, if you can maintain that safe social distance as recommended by the CDC and the WHO, you can get outside. We've spent a lot of time in the backyard. We've made some good memories doing that too. But some fresh air and some sunshine, even if it's not direct sunshine, really does help kind of improve that mood and get you kind of at a good place. Another thing to kind of think about is just your overall eating. Again, seems like something that we know about, but sometimes we can get lost in this moment. So making sure our diets are pretty balanced. We're limiting a lot of the sugar and a lot of that caffeine. Those elements really can kind of aggravate your stress and your anxiety, making it a little bit more kind of intense for you in the moment. So that's just something to think about, as well as limiting screen time, which seems difficult these days, right? Because we are all on a screen and we just have to be. But taking those times throughout the day, just to kind of take a minute to turn the laptop down, to put the phones down, and just kind of disconnect from that for a second. Get up off the chair or off the couch or out of a desk, kind of wherever you're working from home these days, but just to kind of break up that sitting in front of a screen. Really, this is helpful when you're in an office too, not just because of COVID-19, but I know many of us are significantly impacted with the screen time these days because that's how we have to be connected with each other. So making that conscious effort to just spend a little bit of time away from it. And that means the TV, the tablet, the computer, the phone, all that screen time. And then just relax and recharge. So really try to make a conscious effort to take some time for yourself. Just a couple of minutes of quiet time can really kind of refresh, recharge, bring down any of that anxiety that you may be feeling. A lot of people benefit from things like deep breathing or yoga, some meditation, things that really can help you connect, feel balanced, listen to music, read a book. Kind of find a technique that works for you and really try to practice it regularly to kind of help reduce any of those anxious feelings or stressful feelings, or I like to call them the overwhelming moments where it's like all coming at you and you just kind of got to stop it. Just to give yourself that moment of some serenity, some deep breathe, some peace is really helpful for just kind of the overall body and your overall physical health. From there, we're going to focus on mental health. So we're kind of going to do that balance. We gotta try to keep them both kind of together there. So there is some repetitive here. So you'll kind of see focusing back on to maintain wellness, good mental health is keep that regular routine. Again, we are at home and things don't really feel regular, but we can kind of make efforts and make attempts to keep them as regular as we can. So maintaining that schedule is really important. Again, like the bedtime, the waking up time, your meals. That's another struggle I've had with being at home. I lose track of where I am in the day sometimes, and I'll look down and it's 2 o'clock and I haven't had lunch. You know, my kids have had lunch, but I didn't make myself anything. I kind of came back to the computer while they were sitting and having a little bit of lunch to kind of get checked back in. And that can really, impact you if you're not kind of keeping yourself regular and balanced in that way. So getting your works kind of scheduled out. I've tried to make a section each morning where I'll sit down and kind of write down what I really need to get done that day. And if I can get some extra things done, great, but not to burden myself with going overboard to try to get, 3 to-do lists done in one day. That's not normal for us. We can't put that kind of pressure on ourselves. So making time for those things and also scheduling in that time for the activity that you enjoy. Some of that predictability can really help us feel more in control. Another thing to take care of our mind is limiting the exposure to the news. It is important to stay connected. We have to stay connected right now. We need to know what's happening about COVID-19 and everything, about your businesses, your work, your staff, your family. We all need to be connected that way. But sometimes excessive exposure to news and media can certainly heighten our fears a little bit. Also, when we're not getting our news from the most reliable, reputable source. So sometimes that's where the rumors start, that's where the misinformation happens, and it can just kind of take over. It can be overwhelming. So we encourage, keep up to date with what the CDC is putting out, the WHO is putting out, our local media and government is putting out, and of course your own local establishments that you guys may be connected with, such as the chamber. We would certainly know that would be reputable sources that you want to stay connected to. Then staying busy. I don't know that anybody's having a problem with that these days. I feel like we're all on overdrive, but enjoying something that you can do at home, having some positive time to help manage your feelings is really a healthy coping strategy. So enjoy something you can do at home, whether it's a craft, if you are at home with young children, or if you're not, everybody can sometimes benefit from keeping their hands and minds busy with something a little bit different. So finding a hobby that you may enjoy doing at home to help kind of keep yourself busy during these times too. And then focusing on some positive, and this is hard. I'm not going to pretend I do this well every day either, but focus on those positive thoughts. So consider starting each day by kind of identifying what's really going well. What am I thankful for? What's on the top of my gratitude list? Maintaining that sense of hope. We can get lost in the negative, and it doesn't take a long time to do that. And then every day we're just living in that negative space. It's not good for our mental health. It's not good for us at all. So trying to focus on the positive the best that we can. I will also say it's okay to identify with the negative too, though. We can't pretend that there aren't hard times and there aren't tough feelings and tough situations. So that's normal to kind of own that and know it's happening, and then kind of do your best to draw yourself to the positives as well. Another thing is a great thing to think about here is use your moral compass or spiritual life for support. So if you draw strength from any type of belief system, lean on that so that it can bring you some comfort during these times, whatever that may be. And then this isn't a great one that I have to be very intentional about as well, but setting those priorities. We cannot become overwhelmed with creating a life-changing list of things to achieve while we are at home during COVID-19, right? We have to be reasonable. We don't need to set a goal to redo our whole living room, organize every closet, make an entire pantry full of snacks and treats, pressure wash the house, plant a garden, do things at your businesses. It just can't happen. So we have to set reasonable goals each day and kind of outline the steps to make those goals achievable and attainable. And then we have to credit and praise ourselves every time we make a step in the right direction, even if it's a tiny step. Recognizing that some days are just better than others is also really important. I had a couple of days last week, nothing specifically went wrong. It was just heavy days. And I just had to kind of identify and say, this isn't just the best day. You know, it was a hard school day. It was a lot happening with work at the same time, trying to manage some phone calls with children who aren't used to just sitting quietly while mom is on phone calls all day. And just owning that that's okay. I'm thankful that I have a team of staff and colleagues that, you know, can and love and support me regardless and be gracious with me if they hear some sister conflict in the background. But knowing that it's okay to have priorities, it's okay to make an awesome to-do list, and it's okay to not get that list done. So taking time for that, give yourself some grace and be patient with what you're accomplishing each day, and celebrating it is really important too. And then kind of this connection to others. So I kind of mentioned this when we first started, but when we talk about building support and strengthening these relationships during these times, so you'll kind of see a couple examples listed here with making connections. So specifically talking about if you, of course, have to stay at home and distance, you know, many of us are doing that, avoiding that social isolation. So social distancing is, of course, being separate from people, but social isolation is when you're just not connecting at all. So making the time each day to make the virtual connections, kind of like this, you know, we're all connecting, we're just having a nice conversation. It helps us at least see each other and talk to each other. It's kind of the best case scenario. And we're lucky to be able to do this type of work this way too. So doing the email, the texting, the phone call, FaceTiming with family. I know we try to do that a couple of days a week with my parents so they can see the kids, we can all chat, because it's hard not seeing people that we're so accustomed to just, you know, popping over to the house for dinner one night or having them over. So we can certainly do that. Again, if you're working remotely from home, asking your coworkers how they're doing, checking in with them. Don't just make it about work. You know, how are things going? Share those coping tips and socializing virtually. Something that we've all been doing with our work is just sharing some things that aren't work related. So we're sending videos to each other with positive messages, and, you know, just taking a minute to just connect, you know, not make it only talking because we need to talk about work. So that's been really nice too. Another good thing that people have found is kind of doing something from others, finding that purpose and helping those around you. Maybe you're, you know, checking on family and friends. If you have somebody that you know can't get out, maybe helping them with their groceries or a prescription. Of course, you'll see where we encourage you do that by really following the CDC and the WHO and the government recommendations on distancing. But there are ways to still connect and support people during this time, especially if people are quarantined or fall ill. We can still connect with them in that way to be a support system and also receive that support and those helpful, healthy relationships. And then this just kind of ties everything together. So you'll kind of see here, managing that stress overall in your life can be done through the deep breathing, through the exercising, through that relaxation, through the recharge, through the connection, the balanced eating, and that making the list and the setting the priorities. Don't take on things that, you know, aren't maybe not necessary or that can't be taken on right now, but also celebrate the small victories you make in each of those lists. And kind of as we start to wrap up here, and certainly can answer any questions that you all may have, we talk about the difficult situations that we're in. Again, this isn't just about COVID-19, although it's the top of our list right now, but stress is normal. It's a normal psychological and physical reaction to our life demands. A lot of us react very differently to those situations, and it's normal to feel that way during a crisis. But when we have multiple challenges daily, such as what we're all experiencing with COVID, it really can push us to a different place. This is uncharted waters we're in. It is hard to figure out what to even do next, like we kind of mentioned first thing when we got on the call. So it's normal. And we have to be able to kind of say that to ourselves. It's okay to feel this way, and let's kind of figure out how we get through it. The thing about when we feel like we maybe can't get through it, that might be when it's time to kind of ask for some help. So maybe you continue to find yourself having those overwhelming feelings of helplessness or anger, anxiousness. Maybe you're really not able to concentrate, or you have major experience changes in your appetite, your body, your sleeping. When you're continuing to see that type of stuff significantly and frequently for several days, it really is time to seek help. And there are consistent amount of resources that you can reach out to get help from. So you'll kind of see that here, moving to this place, the seeking help. If you are feeling some of those symptoms and you are feeling in a sense of concern that you may want to ask for help, there are a couple ways to do that. You can certainly connect with a close friend or a loved one. We know it's hard to kind of talk about those feelings, but you have to be honest about how you are doing and where you are. You can connect to a minister or a spiritual leader, someone in your faith community, whatever you may lean on in that way. A lot of our agencies have employee assistance programs. If your employer has one, we certainly would ask for you to refer or get a referral to a mental health professional that can really help assess what's going on with you and work with you to make kind of a plan for care. Another kind of simple thing here is just call that primary care provider or a mental health professional and ask about appointment options, maybe to get advice or guidance. I know many of them are still providing options of phone, video, or online appointments amid the COVID-19 pandemic right now. And then there are other organizations to connect to, such as the Department of Mental Health, LRADAC, the National Alliance on Mental Illness, and of course, SAMHSA, Substance Abuse and Mental Health Services Administration. They have a significant amount of resources that can help or guide you in the right way to make some decisions if you're seeking help for yourself or a loved one. So kind of as we close here, some future steps. So we do know that, or we hope that the COVID-19 will continue to balance, and we will continue to accept what is the new normal. I've been careful to say get back to normal because we just don't know what that may or may not look like. But we know that stress won't disappear forever. We may have some of the specific feelings we're feeling right now. We may see them fade some, but stress doesn't just go away when COVID-19, decreases. So we want to make sure we're continuing with these self-care practices to take care of our mental health. We want to increase our ability to cope and be resilient with the ongoing challenges that life brings us. Again, right now we know it's amid COVID-19, but really these are things that happen in our life all the time. So kind of hanging true to these recommendations, I think, can really be helpful as you work to keep yourself balanced and keep yourself well during times of crisis or stress, concern. Just a list of great references if anybody's interested, lots about Mayo Clinic and American Psychological Association, of course, CDC, all this stuff I'm happy to share with anybody that may want some more information as well. So I will, if we're doing questions, I'm certainly happy to help do that. I can mute also if I need to. So I'll kind of see what you all want to do and just leave my contact as the last slide.
Ashley, thank you for that. And will you be able to share this PowerPoint with us so we can share it with the folks on the call?
Absolutely. I can email it right to you when we hang up, Rose.
Oh, that's fantastic.
Sure.
I think some of the things that you talked about, you're right, spot on. They're common sense, but we just forget to be friendly. Yeah. And I liked your give yourself some grace because most of the people on this call, I know pretty well, and most of us probably don't have the ability to give ourselves grace very often. Yeah. So I'll let everybody know we've got a couple of minutes here. We can take some questions. If not, I don't want to tie everyone up. I know it's right before that lunch hour, but let's give everyone just a second to see if we have any questions. Sure. And there's some great resources. So as we always do, we'll have this video up hopefully within 24 hours, and we'll have that source on there for you.
Great.
Okay, we've got a quiet group today. I think everybody may be getting Zoom fatigue.
It happens.
It does happen. And our CEO was able to join us, Carl.
Oh,
He's
good.
standing beside me over here.
Hi, Carl.
Um, in our new world headquarters. I'm going to say that as long as I can, guys.
Yeah.
So, okay. So Ashley, thank you for, and I see several folks there thanking and also sharing with their team. So that's great.
Oh, great.
Your reach goes much beyond those on the call. So folks, we'll get this up later this afternoon. But again, thank you. Thank you to LRADAC and your team over there. And we appreciate what you've shared with us, and we'll try to give ourselves all a little bit of grace today.
Yeah. Thank you so much
Thanks.
for having me.
Thank you. Bye-bye.
Bye, everyone. Be well.
Thank you.